Just 1 week ago, President Trump signed his so-called Big Beautiful bill. It cut around $1 trillion from Medicaid, posing a serious risk to rural hospitals who serve a larger number of patients on the program.
10 News reporter Ethan Ellis is working for you tonight to find out how this will impact rural hospitals in our area.
With the swipe of a pen, President Donald Trump signed what could be a death sentence to some rural hospitals.
Any small change in Medicaid could have a big impact on our bottom line.
The cuts mean 300,000 Virginians could lose their health insurance, leading to less patients at rural hospitals or clinics like the Tri-Area Community Health Center in Ferrum.
I was sort of mentally calculating, okay, how many people might not qualify for Medicaid moving forward? What do we need to do to try and make up for that lost revenue?
The center's CEO, James Worth, says these cuts mean almost $500,000 in lost revenue for the Ferrum Clinic alone, leaving officials there with some tough decisions to make.
If we can't figure out a way to make up for that, then our staff is at risk, our service lines are at risk, even a site might be at risk.
The consequences of this could be deadly.
If we hadn't been here in those instances, then there could have been a death. In the future, if we aren't here, then again, that same thing might happen.
Virginia Hospitals and Healthcare Association's Julian Walker says the impacts of these potential closures will affect more than just the patients themselves.
There is the potential for an economic ripple effect, not just to the direct hospital operation, to its stability and survival, but to the employment it provides, to the financial support it provides to the community as an employer, as an organization that has business relationships with other entities.
The bill did leave $50 billion in funding for rural hospitals, but Walker says that's not guaranteed to come to Southwest Virginia.
Even if all that money went to rural hospitals, it still would not come close to closing the gap of the Medicaid funding losses that are contemplated in this package.
That money also wouldn't go to clinics like Tri-Area. Ethan Ellis, 10 News, working for you.